what does quality healthcare mean to you?
So to me, I've thought about this question quite a bit over the last few weeks. And to me, quality healthcare is preventative. I think that that is something, it's preventative and it's also timely. And these are two things that I think our healthcare system specifically lacks. And I think if we can improve that piece of it, the system as a whole will improve. Preventative being, access when things just maybe don't feel right. Everyone has their annual physical that's now covered, but other than that, a lot of people have to pay, a $90 copay to go to the doctor if something doesn't feel quite right, and they put it off and it ends up compounding and becoming something bigger.
Mm.
And the second thing I would say is just the timeliness. I hear all the time about people that are personal to me who call and say, "Hey, like I need to have this procedure done, but it has to go through this authorization process. Do you know of anything that can speed it up?" And and so, again, just to kind of go back to your question, timeliness and preventative.
Yeah, interesting. I had a guest on who was one of the first people that was able to convince HMOs to have health incentives built into the system. So if you are going to the gym, they're going to cover that because it's going to help you to be a healthier person, and ultimately will reduce the cost of your healthcare over the long term, even though it's not, there's not a direct correlation, but it's funding good health choices will prevent future issues. And I think that's a very interesting take on it. And the access as well. I will mention this. I interviewed patients from around the world, and we talked about healthcare and talked about the way that they receive healthcare in other countries, and none of them feel like their country has it exactly right. So
Hmm.
that is, it's both comforting and scary to think we've got, however many hundred and some odd countries around the world, and none of them have it exactly right. So there's a lot of work to be done, but I think that you're spot on when it comes to preventing and then making sure that there is access to healthcare. Can you talk a little bit more about the concept of access to healthcare? Is it just speeding up the process by which people receive the services that they need, or is there more to it than that?
Well, I think that it's definitely when it comes to more severe situations, you need a surgery um, or you have an autoimmune disorder and you can't figure out what's wrong with you and you're bouncing around to specialists, but specialists, in order to see this specialist, you need a referral or um, this special, this I see this a lot where endocrinologists, there's a huge um, backlog to see an endocrinologist in Los Angeles. I mean, I don't know if it's, state specific or, look geographically specific, but there are certain things that require, maybe it's not immediate attention, but where people feel like my everyday life is being impacted.
Mm.
And I either have to bounce around all over the place trying to get a referral, or I just, the soonest this doctor, the specialist can see me is in 3 months. Well, the problem is now. And so I don't know, unfortunately, I don't know exactly
Sure.
what the answer to that is, but I think that our insurance industry, and that's what I'm very familiar with because I work in it,
Right.
I think that the insurance industry, they hold all the cards.
Mm.
And I don't want to jump ahead to one of your other questions because
Yep.
I have a passionate answer, but
Yep.
I think that the insurance industries hold a lot of the cards, and I wish that that was not always the case.
Right. And this is a theme that I've heard through many interviews before, and that is
Mhm.
why, when we are looking for a plan of treatment, the first question becomes, what kind of insurance do you have? And it is the insurance company that is determining your plan of treatment rather than your medical professional. And that's, we may get into that as we move through the interview and move through the next question. So, uh, can you give me an example of quality healthcare?
Something that I consider quality healthcare, I love to see uh, like HSAs and HRAs, health savings plans, from employers where they give a certain spending allowance and you're able to spend that on, it doesn't necessarily need to be on a basic office visit. If you need to go to a chiropractor or if you need to go to some sort of alternative medicine therapy, there's a certain fund set aside where people can choose what kind of treatment they need. I like the idea of that. I think telehealth has really helped with the access issue. The fact that now physicians are able to prescribe an antibiotic to someone who might be in a rural community and need an antibiotic but isn't able to drive, an hour and a half to see a doctor. So I think there's certain things that are really helping, but there's obviously still a lot of work to do.
Sure. And I think there is a there's a balance that needs to be seen there, and that is, so for somebody like me who has a disability, sometimes transportation is an issue. So being able to have a telehealth visit where I'm seen without having to leave the house is a tremendous convenience, and it opens up a lot of access. But at the same time, there are secondary issues that may not be seen because I'm not actually being seen in the office. They're not looking at, for example, my legs to see if there's swelling in my legs, or to see if there's discoloration in my hands, or any of the indicators that might be there are not being seen because it's literally just a face in a box. But it's a balance that you've got to find
Totally.
between the two of them to do access. You have access to care, but it's not in-depth care, and there needs to be the balance to say, okay, sometimes people need more in-depth care than just the telehealth visit. Does that
Yeah.
resonate with you at all?
Oh, absolutely. I would definitely say that an in-person anything, right, can sometimes be more effective and more thorough and um, overall just a more connected experience.
Sure.
Uh, but there are certain occasions, like I said, where I just think that the telehealth and just having the option to do both is a positive thing. I'd also say another example of just quality healthcare, in my opinion, is just like individual empowerment,
Mm,
understanding your body, understanding health, just having knowledge. I mean, knowledge is power. And so I think that having knowledge and understanding about your body, your health, what feels good to you, what does not feel good to you, when to ask for help, and when maybe you can, um, you know, do a little bit of research and say, like, maybe, this diet isn't working for me, or, I think empowerment is really key to quality healthcare.
mm.
Um, and if the more people know and the more people understand both their own personal health and then also like the healthcare system and how it works and how to get the care they need when they need it, I think that those are two really key components to
Sure.
quality healthcare.
But so there's a personal responsibility. The onus of knowledge has shifted. It used to be, in the 1920s, you went to the doctor and the doctor knew everything and you really didn't have the knowledge. And now the information is readily available. You can Google, you can keep, track of your electronic medical records, all of those things.
Yeah.
And it's all there. Okay, good. So we've got 5 minutes and we've got three more questions to get through. So you've been answering all of my questions very well, and it's my fault for falling behind. But here we go. What do you wish people understood about your role in healthcare?
So maybe what I wish people understood is how much goes on behind the scenes on a daily basis to get insurance companies to do what they're supposed to do. Not all the time, but there is a lot of stuff that insurance companies do to withhold money and prevent people from getting treatment. And it makes me sad. And I just am such an advocate for what I do. And I feel a lot of purpose behind what I do because of what I see.
Mm.
So I just, you know, there's a lot more that goes on behind the scenes, I think, than just the doctor's visit.
Yeah, I have. I try not to be a conspiracy theorist and everything, but sometimes I wonder if there's not an algorithm in the insurance industry in which, like, every fifth case just gets booted, not because of anything wrong with the case, but just because, hey, let's see if we reject this, will they just pay it out of pocket, or what will they do, and see where we go. But that's a topic for a different day.
Yeah.
So, what excites you about the future of healthcare?
I mean, what excites me is to see, like I kind of mentioned before, the HSA, HRAs. I like seeing that people are at least talking about and starting to take little actions to open up the idea of what health is. I like seeing some Eastern medicine stuff come into US discussion. I like that mental health is a topic now that didn't used to be. I think that there are a lot of people struggling who you know, who didn't always feel comfortable talking about it. So I
Mm,
like, that makes me hopeful. But again, I kind of keep going back to, I always go back to just your own personal empowerment and knowing like your own body and knowing that there are resources out there and you just have to find them and it might be hard, but there is a way and there are people who are willing to help you. And it's just about finding those people.
right. Well, excellent. All right. Last question for you. And that is, what is one thing medical professionals can start doing today to improve the quality of healthcare?
My answer to that is I think that medical professionals can either hire someone or invest in a third party company but someone who knows the operational piece of their business. Physicians and medical professionals went to medical school to practice medicine. They're good at medicine, and I'm not saying that they're not going to be good at, let's
Mm,
say, insurance billing or accounting, but that's not their wheelhouse, and insurance is complex. And I think that they the best thing that any practitioner can do for their company is again to hire someone who has the time, who has the knowledge and the skills to go out and make sure that they're getting paid what they're owed, because that's how they're going to be able to provide exceptional care to their patients.
It's funny. I feel like the conversation has come full circle to say medical professionals, they get into this business because they are passionate about helping people. They have an expertise in medicine, whatever their branch of medicine is, whatever their role is in the healthcare system. They didn't get into it to run a business. And sometimes the business end of it is difficult, and you're dealing with, as you said, complex issues with insurance and just a whole variety of things that are not medical in nature, but are part of running a business.